Good evening, everyone, in person and virtually. Thank you for joining us for another episode of Let's Talk COVID Vaccines. We have a wonderful panelist of speakers here today, both clinicians and public health professionals, to talk about the COVID-19 vaccine and answer questions that you may have about the vaccine and the importance of it. So I'm Dr. Mafudia Suaray. I'm a family medicine physician. I'm an associate professor with the Department of Family and Medicine and Community Health at Rutgers, Robert Wood Johnson Medical School. I also work as a hospitalist at Robert Wood Johnson Hospital. So I've had the privilege of taking care of way too many COVID-19 patients and seeing firsthand what COVID-19 does to people. I've had members of my family affected also by COVID-19. And we know how COVID-19 has been devastating, especially Black and Brown communities, the effect of it. And so we wanted to talk about the vaccine and why it is important and why people should consider getting the vaccine to help in this fight against this COVID-19 pandemic. So I'm going to have our speakers introduce themselves and give a 5-minute presentation. And then we'll have questions from the audience, whether live or virtual, as they come up. I will have go first. Oh, and so I'm basically going to serve as a moderator for the panel. And I have Dr. Karen Lin also with the Department of Family and Community Medicine, who basically is the backbone behind a lot of this and pulling this together. So Dr. Lin is going to be helping me also moderate and record. And we'll have the recordings available to share with your different networks so that those who did not have the opportunity to join us virtually in person can also have access to the information. So I will have Thalia Sirjue from the New Jersey Department of Health. I'm the Deputy Chief of Staff at the New Jersey Department of Health. I'll have you go first, introduce yourself and go ahead with your presentation.
Thank you so much, and good evening, everybody. As she noted, I am Thalia Sirjue, Deputy Chief of Staff at the New Jersey Department of Health. That's been my day job. Everybody at the Department of Health has a COVID job as well, and mine has been to lead our statewide contact tracing program. And currently, since that has been smoothing out, working with our community vaccination team and our COVID-19 testing team to really start integrating things into our kind of daily workflows here at the department as we attempt to continue addressing the pandemic, but also starting to get back to some form of the new normal, whatever the heck that is. So I wanted to just take a moment to share some data with you all to kind of set the stage of why this is so important and just really why we're all here. So I'll be quick, but in New Jersey, as of today, we have had 894,224 confirmed COVID cases. That just is confirmed PCR cases. There are thousands more of our antigen tests as well that are not even included in that number. Most of those are rapid antigen tests. We have unfortunately suffered 23,754 deaths in the state. Now that's important as the statewide perspective, but I also wanted to take a moment to break it down a little bit so that you can see the race ethnicity breakdown. As of the last run of our data, which was June 21st, you'll see that when you age adjust the data, which it's just a fancy way of kind of equalizing it a little bit for populations that have different age breakdowns. You'll see that in the case rate, hospitalization rate, and mortality rate, Black and Hispanic New Jersey residents far outpaced the rates of white and Asian New Jersey residents in all three categories. And hospitalization rate and mortality rate for COVID is more than double. And I think that's really important to just set the stage of, again, like I said, why we're here. So then moving to our community protection, our vaccination, what we've all been talking about nonstop. In the state, we've administered over 10 million doses of vaccine. There are over 5 million individuals in New Jersey who have received at least one dose of their vaccine, and over 5 million New Jersey residents who are fully vaccinated, which is incredible. Again, to the right of the slide, you'll see a breakdown by race ethnicity. Now, this is important because the bar on the right shows the demographic breakdown by our total state population. And so you'll see there that our population is approximately 10% Asian, 13% Black African American, 21% Hispanic, 54% white, and about 2% other or unknown. However, when you look at the bar on the left side, you'll see that the stats for our vaccination in those same racial or ethnic backgrounds don't necessarily match up to the population. In particular, our Black vaccination rate is only at about 7%. Is lingered there for quite some time now. And what we really need to see is it moving closer to the 13% that's representative of the actual Black African American population in the state of New Jersey. This is the same with our Hispanic population, which is doing slightly better, but still under where it needs to be. So people ask all the time, why are we talking about this so much? Why vaccine, vaccine, vaccine? It's all that I hear about. It's really, really important. Not only is it one of the few tools that we have in our toolbox to keep people safe from getting sick from COVID-19, but it's important as we start thinking through the prevalence of different variants. At this time, experts do not know how long someone will be protected from getting sick again after recovering from COVID-19. So folks who are even saying, oh, I've had it already, I don't need to get vaccinated, that is also false from the data that we have, from the information that we have from our experts. The studies have shown that vaccination provides a really strong boost in protection for anyone who has recovered from COVID-19. So that is really important. Additionally, always try to share with people that getting vaccinated, even if you then contract COVID-19, it still is going to keep you safer from any hospitalization or even death. So that is critically important. When we think through our variants, studies have shown that the current vaccines do work on the circulating variants. And it's also important to note that the more people that are vaccinated, the less places that COVID-19 has to transmit to, less hosts. And in those cases, most of the time that means that there are less of a chance of new variants developing. So it is really critical for us to get as much of our population vaccinated as possible. And I know my colleagues are going to share some additional information about that. So hopefully I stuck within my 10-minute mark, and we can talk a little bit more if you have any questions.
Thank you so much, Thalia. I have Dr. Swaminathan.
Thank you so much. Good evening, everyone. I'm Shobha Swaminanthan. I'm the Director of HIV Programs at Rutgers, New Jersey Medical School, and I've been an infectious diseases physician at the medical school at this point for 17 years. Time flies. Time flies when you're and when you enjoy the work that you do. You know, before 18 months ago, the bulk of my work, I would say all of my work, was really in the care and treatment of persons with and at risk for HIV infection. We run a large Ryan-wide clinic, so we have always had to deal with health disparities, particularly as it impacts minority communities, because persons of color are, much more vulnerable to acquiring HIV infection than white persons, and that remains, regardless of other risk factors. And this really impacts on their health and their outcomes in many different ways. And so we've really worked hard, within our community to try to, address a lot of those barriers and the stigma associated with it. And with a year ago, when COVID hit, it was almost the same thing, because we saw, in Essex County, it has the largest numbers of persons dying from COVID-19. And the persons who died were disproportionately Hispanic or Black. And there are multiple factors, but a lot of it are also socioeconomic and, increased prevalence of comorbidities like diabetes, high blood pressure, heart conditions. But also, when you talk about, inequity, persons of color are much more likely to be working in areas that require face-to-face interaction, that require people to come on site. They don't have the luxury of working remotely online or a computer sitting at home. They have to be at the grocery store. They are the ones manning the trains, the public transport, essential workers. We value them, but they really face the brunt of the epidemic. A lot of our nurses, the tech. So I have seen firsthand, as has everyone here. I really think there hasn't been a single person that we know of who hasn't been personally impacted by COVID-19. So now that we have all of that, what next? We have to learn from our mistakes, because if we don't, then we don't. And what have we learned? So yes, COVID-19 is a devastating illness. And there's only two ways really to protect yourself when it comes to infections: trying to find medications to help treat it, or trying to develop vaccines to prevent the infection. And so those are really the only two options. In general, for most viral infections, treatment options tend to be less effective than vaccines. If you can find a safe and effective vaccine for a viral infection, it is always going to be a much better, safer bet than trying to find antivirals. It takes much longer time to find effective antivirals, and they don't always work as effectively. It's much better to teach your immune system to effectively fight off the virus. That's how most infections that have been eradicated or significantly reduced, like smallpox, chickenpox, measles, influenza, it has been the effectiveness of vaccines that have led to those improvements. But so COVID-19 vaccine, right? So last year I was the principal investigator in Newark for the Moderna vaccine trial. And, my parents are older. They asked me, so when do you think you'll get the vaccine? I was like, we've never had a vaccine come that quickly. It's probably going to take at least a year or two. There's no way you're going to get something before that. In a large part, and that's because historically, most clinical trials enroll people with about 3,000 or 4,000. Most awesome, amazing vaccines have an effectiveness of about maybe 60, 70%. That's generally how effective most influenza vaccines work. So when you put those numbers together, it's going to take you 2 years, 3 years of that. Well, guess what? We were in the middle of a pandemic. People were dying by hordes, by the hundreds of thousands. We don't have the luxury of waiting 5 years. So what can we do to ensure that the vaccines are safe and effective, but trying to expedite? If anyone has experience in government and approvals, no offense, bureaucracy takes a lot of time. Reviewing paperwork, it takes the FDA on an average about 6 to 7 months to review something. It doesn't mean that the data takes 6 to 7 months. It's just, pushing, reviewing, looking at it, taking your time. Researchers across the world stopped everything. People like myself were devoted our life mission to HIV treatment and prevention. We all pivoted to this global pandemic. We put all our efforts into this. You didn't have competition. You typically have, pharma A and pharma B and pharma C. They're all working in secret, nobody talking about what they're finding. So the government actually took the initiative and invested in multiple different platforms to say, essentially telling the pharmaceutical industry, we want you to work collaboratively. This is a pandemic. This is a humanitarian health crisis. We can't have you working one another. In order to reduce your risk, we, the US government, will invest and will take on the risk. If it fails, fine, we'll take the risk. So at least your stock and your investments won't be at loss, right? Because this is a public health investment in the lives of the US population and the global population, really. So the US government invested money. It made the companies work together. They ensured that there was a single independent data safety monitoring board. So somebody else, separate from the trial, separate from the company, separate from the government, was monitoring the data in the trials to ensure that the participants' safety was of utmost importance. That was at the core. And to see if the data that was gathered was actually accurate. I have people coming to my site every 2 weeks to look at the data. Nothing has been monitored this effectively. I've been doing clinical trials for over 15 years. I've never had a monitor come to my site every 2 weeks. Okay, we're looking at your charts. But that shows you that there have been ample safety measures in place. Clinical trial size, it will take us too long if we enroll 3,000 people. So guess what? We enroll 30 to 40,000 participants in each of these studies. Okay, so by increasing the amount of people enrolled, you're able to shorten the timeline needed to find the effectiveness. And lastly, and most importantly, even with all of these measures in place, if the vaccine was 50% effective, it would have taken us 18 months to 24 months to prove its effectiveness. Guess what? Both the messenger RNA vaccines were 95% effective. Therefore, at the very first check, within 8 weeks of all the enrollments, they were able to prove that the vaccines were effective. Also, remember, you can only prove that it works if you have enough cases. In the fall and winter of last year, we were in the middle of a big second curve in the US, at which time vaccine efficacy cases were being counted. So it was almost like a perfect storm when everything, I thank, I'm religious. I believe in God and I believe in faith. And I feel like it's almost like everything aligned to make sure that things fell in place perfectly. It couldn't, and therefore the vaccines were effective. And lastly, people have asked me, well, how can this little safety data be enough? How can you tell me that the vaccines are safe? Because most medications, you follow people for years. Vaccines are very different. They're inherently different from medications. Vaccines are only given once or twice. That's it. It's not like a pill you take every single day. A medication for high blood pressure, diabetes, you take it every day. So there is a risk of additive toxicity. The more medication you take, maybe it'll cause more side effects. Vaccines aren't like that. You give it, and it's done. What do the vaccines do? Once they're in your body, they teach it to produce antibodies, and then they disappear. The vaccines they're not lingering in your body. And 99% of vaccine side effects occur in the first 2 to 6 weeks. It's extremely rare to have very late side effects. It's because of all of this that we are able to say that the vaccines are in fact safe and effective. I'm going to stop here and take other things as questions come along.
Thank you so much, Dr. Swaminathan. That was a very detailed, basic explanation of the vaccine trial process. Thank you. I really appreciate it. Dr. Chaletta Ayers.
Well, good evening, and thank you for inviting me. My name is Chaletta Ayers. I'm an associate professor in the Department of OBGYN, as well as the vice chair of clinical services for the Department of OBGYN as well. And I deliver babies, and I see women throughout the life cycle. And what I want to share with you are the top 3 questions that individuals have been coming and asking me as their OBGYN, specifically about the vaccine. And I think that's important because there's a lot of myths. And I think my colleague just talked about that. There are a lot of myths out there regarding why so short period of time. Does this vaccine really work? And with the OB data, it was a little difficult because those initial studies did not have pregnant women in them. However, as the studies went along, women did become pregnant during those studies, and they're being followed. Our national, as well as our global WHO, World Health Organization, really promotes that all women should be offered the vaccine, and pregnant women. And the safety of it at this point in time, looking at data specifically from our European colleagues, when they've looked at animal models, have shown that it's pretty safe during pregnancy. And that when you look at the benefits and the risk, you have to look at, we are in a pandemic. And number two, that pregnant women have an increased risk of having increased symptoms as well as more devastating outcomes than women who are not pregnant. And we've seen that in our data from the state as well as our national data. So we've seen that women who are pregnant have an increased risk if they do get COVID to become sicker than women who are not pregnant, as well as be placed on ventilators, as well as we've seen also increased risks of preterm labor for women who are infected with COVID-19. And so when we look at that, and actually I've seen it with the patients that I've taken care of during this pandemic, it's very devastating. When you have a young woman that you see in an ICU, intubated, who is also pregnant. And we're not saying that that happens to every woman, and I'm not trying to put fear, but it is a risk, and we can't tell which women will or will not have that risk. And it's an awful devastating event, not only for that pregnant woman, but also for their family. So when pregnant women come to me and ask, should I get vaccinated? I said, yes, you should be vaccinated, but you should also talk about what your benefit and risk, because we also know that there's certain pregnant women who are at even more risk just from their pregnancy. We've seen women of color are more at risk, women who are obese, women who have diabetes or hypertension. Those women have significant increased risk of having more complications with COVID-19 infection than other women who don't. The second question that comes to me as well is that, you know, we're seeing more women have educating themselves and knowing that they want to breastfeed. And that's very important, that they want to take care not only of themselves, but of their child, their unborn child or their newly born child. And they say, so if I take this vaccine, is it okay for me to breastfeed? And we've known that as our colleague just stated, that once you get the vaccination, that the vaccine is, once it does what it needs to do to produce those antibodies, it goes out of your body. It is not interfere with different parts of your cell, as myths have happened, or interfere with your DNA, as there's another myth. That is not true. But we know that women who are vaccinated can produce the antibodies, and those antibodies can travel through the breast milk to their babies. We're not quite sure how much that helps. We think it might help some of those newborns a little bit, but it has been studied and shown that those babies do have antibodies from their moms who are vaccinated. They haven't shown that there is any negative effects to those newborns. Women who are getting the vaccine or had the vaccine are actually being monitored. Any woman who gets the vaccine, the government is monitoring those women and looking for side effects. And as we've heard before, most of those negative side effects, if they occur within the first 5 to 6 weeks. We have not seen long-term side effects from those individuals. And the data that we're looking at right now is some of the data specifically from Pfizer, as we're seeing, regarding those women that did get the vaccine during the studies, and some of them have already delivered, and their children are now past that 3-month spot. So we are seeing and following those, and we haven't seen any significant negative ramifications or negative side effects so far. The third question, I think it has to come across as an OBGYN, is that women are saying, you know, we're now during the pandemic, a lot of individuals have put their conceiving or trying to get pregnant on hold because of the pandemic. Now they're saying, I want to get the vaccine. Will this affect my fertility? We know the answer is no. A vaccine will not affect the male or female fertility. And I think this is important to discuss, not only for older individuals, but also individuals. I have women who have children who are there, they want their children to get vaccinated. And that's a question they do ask. And we have 2 pediatricians on and our family practice doctors on, who probably will talk a little bit more about that as well, because those are questions that are real questions that women will come to me and ask. we have looked at vaccines a long term, and we have not seen any of the vaccines that we've used from over the last 20 to 30 years that has had impact on fertility. And especially the mRNA has been looked at how it impacts other cells in the body and has not shown that it has any impact on the reproductive organs of women or men. So you can really feel comfort that we have looked at that, and those are real issues. The final myth we are hearing too is, does this affect my menstrual cycle? This is something that's ongoing, and we're hearing this a little bit more often. We see that it might impact. It's not really that the vaccine is impacting the menstrual cycle. We don't think that it has anything to do with the reproductive organs, as I stated before, but you have to understand that the pandemic, the whole concept of stress, possibly has impacted certain things, but we know long-term that it might, the period might come a little earlier or might be slightly delayed, but we have not seen any long-term effects regarding the vaccine affecting women's menstrual cycles. I do want to say that we are learning as we go along. And one thing we have learned is that we probably should share with women that they should delay getting mammograms for at least 3 to 4 weeks after the vaccine. And most people say 4 to 6. And that's because we know that when you get vaccines, it's really charging your body up to produce those antibodies. And when it does that, sometimes parts of your body will respond to that, like your lymph nodes. And so when women were getting the vaccine, our radiology colleagues were saying, you know, the mammograms are looking a little different. There was lymph nodes there, and then we're bringing patients back later on, and then those lymph nodes were then becoming normal. And they said, what is happening? And we weren't asking those women, have you been vaccinated? So you might be asked that question when you go for your mammogram. Have you gotten your COVID-19 vaccine? And when was it? That's not to say that there's anything wrong. It's just saying that we're trying to avoid you from getting multiple procedures or having to come back for a follow-up x-ray or mammogram. So we're learning as we're going along. Thank you.
Thank you, Dr. Ayers. Thank you for addressing those very important questions. And those come up a lot. Because, you know, we all know that women, you know, are the ones that go out to look for the information, and then they tell the men, okay, you can do it or not. So, I know in my household, I was the one doing the researching, and then I told my husband, okay, I think we can go get the vaccine now. Dr. Whitley-Williams, I'll have you go next.
Thank you so much, Dr. Suaray. I'm Patricia Whitley-Williams. I'm Chief of Pediatric Infectious Diseases and Professor of Pediatrics at Rutgers Robert Wood Johnson Medical School. I'm also the Associate Dean for Inclusion and Diversity. So if I could have the second slide, please. So of course, I was asked about COVID-19 vaccines for children and adolescents. And one of the, I think it maybe if you put this, thank you very much. Yep, great, thanks. So what do we know about COVID-19 viral infections in children, and why should they get vaccinated? Well, I saw plenty of children that were admitted to the hospital that were infected with COVID-19 virus. I can tell you the smaller they were, you heard Dr. Ayers talk about the newborns, and we did have children who were admitted for maybe fever, a little bit of runny nose, maybe, or cough, a little congestion, or some were totally without any symptoms, and they did test positive for COVID-19 virus. But it appears that the younger the children were, the less sick they were, even if they were infected with COVID-19. We know that fewer children were infected with the virus compared to adults. But we do know that they could get sick. And whether they were sick or not, children could spread the COVID-19 virus to others if they were infected. So for all of those reasons, and when children got sick, they actually were admitted to the hospital with sometimes pneumonia. Sometimes they did require the ventilator. And they also had this other illness called multi-inflammatory syndrome. And all that means is that several of their organs were affected as a result of being infected with COVID-19. Some of them had very low blood pressures and needed to be supported with medications. They needed to be admitted to the intensive care unit. Another thing we saw is that this virus in some way may have affected the heart muscle. And so the heart muscle didn't beat and contract and push out the blood from the heart to the rest of the body as well or as efficiently as it should. But the good news was that these children survived. We had very few deaths. In fact, I don't think we had any deaths except for one at our hospital. And that was true of across the country. Children tended to get better, even if they did end up on the ventilator. And their heart function or their ability of their heart to pump normally and their blood pressures, all of that returned to normal. So for these reasons, the Centers for Disease Control recommends that everyone 12 years and older should get a COVID-19 vaccination to protect them against getting infected. Next slide. So the other question I was asked, and we're about to send, or we're talking about sending children back to school in about another 4 to 8 weeks. Can teachers get COVID-19 from children if the children are infected? And if the children get infected at school, can they bring that home to their parents? And there have been several studies, one done here in the US and others in the United Kingdom and the Scandinavian countries, next slide, that have tried to look at this. And one of the best studies, and I'm just going to, if you would focus on the conclusions, one of the best studies was done in North Carolina. It involved 11 school districts, and they looked at how many children got infected with COVID-19 in the first 9 weeks of class. There were greater than 90,000 students involved in this study and staff, and they were attending school in person, face to face. They also looked at how many cases were occurring in the community unrelated to school. And there was almost 800 what they call a community-acquired SARS-CoV-2 is the name of the virus that causes COVID-19 infections. And then the health department was able to track and trace the infections that were acquired within the schools. And it was determined there were an additional 32 infections that were acquired within the schools. But there were no instances of where a child who was infected was spread the infection to an adult. So as in conclusion, that during these first 9 weeks of face-to-face in school instruction in North Carolina, there was extremely limited spread of the infection within the schools. And this was determined by actually tracking these students as well as staff, as well as people in the community. So this is very, very good news. Next slide. So in answer to, should we open, not to open? I know this discussion is taking place probably in every county and every state across this nation, but one thing that is for sure that is very important to do data tracking and to track whether individuals are becoming infected and where those cases are occurring. It's also important to know what they call the transmission rate, how many people are being infected in that particular community. And reducing spread in schools of this virus is a shared responsibility. We're all responsible. So the whole healthcare team, our school administrators and leaders, teachers, our families. We really do share this responsibility. But one thing we know for sure, that continuing use of masks and physical distancing, at least 3 to 6 feet, good hand washing, good respiratory etiquette, which means sneezing or coughing into your arm, good cleaning, and maintaining healthy facilities, school facilities, as well as, again, the tracing of where these cases are occurring. And if they do occur, that certainly isolation and quarantine be done immediately. So we know strict adherence can limit the spread in school setting, and there are plenty of tools and resources on the cdc.gov website for guidance for our schools and for our teachers. But the main thing is continue to vaccinate, because we have seen the number of cases, just as in our own state as across the country. When you vaccinate, we saw a decrease in the number of active COVID-19 infections. And I'm going to end, next slide, very quickly, because schools are important. They are an important part of the infrastructure of our communities. They're an important part of our children's lives. Obviously, we need to make sure that they're safe and supportive learning environments for our kids. But schools also provide employment for teachers and other staff. It's important to provide critical services. Many of our children get their school meals for both breakfast and lunch at our schools. They also provide sometimes physical, actually medical care, as well as behavioral health and mental health services right on site at the schools. And then there are the indirect benefits to the community, which includes people having a job, people being able to work. And also, if our children are in school, that also allows their parents, guardians, and caregivers to go to work and earn a living as well. So I'm going to stop here, and thank you for letting me participate in this seminar.
Thank you so much, Dr. Williams, for that very great information about the value of vaccination for the pediatric population. I will open up to questions. If anyone in the audience has any questions, you can raise your hand, you can speak up or type in the chat. And also in live audience, I have a couple. If you have any questions for our panelists, I'll let you guys go first. Don't be shy, whether it's a question you have or you've heard going around, something that you want clarified.
Actually, I have a question, Noemi Brown.
Hi.
Can I ask my question now?
Yes, please, go ahead.
Okay, I had the J&J vaccine, and I'm a little bit concerned because we don't hear anything about it anymore, the benefits or how long, we don't hear anything. So I'm concerned about that. So that's my question. Why don't we hear anything? And if anyone could tell me, the benefits of this one.
Okay. That's a good question, because they paused the J&J vaccine for a bit, and then it started using it again, but it probably hasn't been clear to the general population, what exactly were the findings. So who wants to take that? Dr. Swaminanthan?
I can take that. So, there's a couple of reasons. In the US, Moderna and Pfizer really came out so much earlier. I think they came out at good about 2 months or so ahead of time, and the vaccinations were already, well up and going. Additionally, because Pfizer and Moderna vaccines require cold storage, which really limits where you can administer the vaccine. So the rest of a lot of J&J vaccine also ended up getting exported to other sites, etc. international sites just because it's easier to administer. And then thirdly, the pause, it was about a 3-week pause, I want to say in April, when they paused it because there were a couple of case reports. Initially, there were about 8, and since then there were slightly more, of a rare type of a blood clotting disorder, actually, that seemed to occur predominantly in young women about 18 to 48 years of age. And initially, because it was new, a lot of the treating physicians didn't know how to recognize it and how to treat it. It appears to be very similar to another condition that's been well established with another blood thinner. So the treatment for that, for this particular time of blood clots, is actually different from normally how you would treat blood clots. So now, so the summary is, so yes, this is a rare side effect, but it definitely is associated with J&J and actually with AstraZeneca, which are similar type of vaccine technologies. And it took us some time to figure out how to treat it. So, but it is extremely rare, and therefore the vaccine is effective. When you look at the vaccine effectiveness, Pfizer and Moderna said, well, the vaccine's about 94, 95% in the clinical trials to prevent symptomatic COVID disease. And the J&J vaccine in the study was about 72% or so effective against symptomatic infections in the US, and was about 85% effective against moderate to severe infection. So at the end of the day, we do want the vaccine to prevent, it would be ideal if it prevented all infections. But at the very least, we want to make sure it prevents people from dying or getting seriously ill or getting in the ICU. All 3 vaccines appear to be almost as effective in doing that. With respect to the one that's of more concern now is really as nature, you can never win against Mother Nature. The hands down. Nature will find a way to evolve and change. So viruses, when left uncontrolled, when there's a lot of unvaccinated population, it's like a party for them. When a virus is in a party, it figures out, oh, there's something there. Let me figure out how I can bypass it. And that's how variants emerge naturally. It's a natural process of evolution. It occurs all the time, not just with COVID-19, but many other viruses. In fact, COVID-19, the variants emerge much slower than many of the other vaccines. Okay, so Pfizer and Moderna and J&J have released data actually against many of the variants. So they appear to be quite effective against the UK strain. And the more recent variant, the Delta variant, the effectiveness is slightly lower, And so all 3 vaccines, none of them are 95%. They're dropping down to maybe the 80s or 70s, but still appear to be extremely effective in preventing serious infections and deaths. A study just came out this morning, and I haven't had the chance to look at it. That's about Pfizer in Israel. That's only because Pfizer was the only vaccine given in Israel. So that's why you keep hearing that information. That the efficacy against the Delta variant is less. In short, at this time, if someone has received the J&J vaccine like yourself, what do you do? I think the J&J vaccine, based on the information we currently have, should protect you against COVID-19 and should definitely protect you from moderate to severe infection. But we are getting more information with time. I suspect there will be additional information forthcoming with respect to the J&J vaccine in the next couple of weeks to confirm this information.
Thank you, Dr. Swaminathan. That's an important point, because it seems like based on the country and what that predominant vaccine that's being used, and of course, there's a lot of noise from the Western countries. So you hear about the vaccines that are, most commonly used there, and sometimes you don't hear about, the other ones. And I know, for, my home country in Sierra Leone, they have AstraZeneca and they have another vaccine called Sinopharm. That's what, they're using. So I get calls, but people asking, well, does it really work? How good it is, and what's the efficacy? And then other one is concerned about the Delta variant, and do any of those vaccines, how good are they against the Delta variant? So what you're telling us is then the efficacy, how good they are against the Delta is not as great as the 95% that we initially got from the studies, but still pretty good, still very good. In terms of protecting against, serious COVID infection and definitely against death. So, we still feel confident that we have good protection, but we all still need to continue to take precautions.
And I will just add that the flu shot in a great year is about 65% effective. In many years, it's about 40% effective, but it's still effective. So even if the efficacy of the COVID vaccine went down by 10 or 20% from 95 to 75%, it's still so much better than than the flu shot. So it still works. So get the shot.
So we just want to give a reassurance to the person who posed the question that you say that you received J&J and you worry about it, and you are fine. I personally involved with a vaccine center in New Brunswick. There's a federal qualified health center called Chaletta Health Center. And we've been giving out J&J and Moderna. And knock on wood, so far, we did not see any adverse reaction. I also want to remind people that when we prescribe birth control pill, we generally would warn patients and say there's a risk of blood clot or making your blood thicker. So it's this vaccine is not worse than a regular birth control pill. And but at this moment, we do tell the people they want vaccine, and we say CDC had post 2 weeks, study all the data, and we recommend that from age 19 to 49 would get other vaccine other than J&J. But J&J is still fine, still protective, and in fact, for some of the hard to reach people like homebound people or homeless population, we prefer to give 1 dose than the 2 dose, because if we give the 2 dose one, we don't know where to find them again.
The other thing I would like to add to that is that most of the complications were within that 6-week period of time. So after that period of time, we're reassuring people that you probably will not get that side effect of the blood clot, just for clarification.
And I do believe that it was, in that, like Dr. Swaminanthan said, that 18 to 40 age group and women, correct, that had the side effect. I believe all the cases were women.
There was one man.
There was one man, okay.
This is Dr. Whitley-Williams again, and I would like to just reassure the person that asked that question that there is ongoing safety monitoring of these vaccines. There are at least 4 different, I'll say, methods or ways of picking up any side effects from these vaccines. If you received a vaccine, you probably got B-Safe. It was a program that you could use on your cell phone, and it asks you questions 24, 48 hours, 72 hours, and then maybe next week and so forth to try to capture all of the side effects that might be occurring. The other thing that is going on, the Department of Defense also, remember, they vaccinate all their recruits. Theirs is mandatory. So they also have a safety reporting system. And as you heard from Dr. Swaminanthan, that there was a paper published from Israel. I sit on the safety committee. We meet every Monday afternoon except for yesterday. And we have invited people from the scientists from Israel, from UK. They join us. It's probably the middle of the night for some of them, but they do join us at these meetings to discuss what they're seeing, because we want to pick up if there's anything that may be harmful to the public. So this is what we call the risk versus the benefit. These side effects that are so serious are so rare that you're more likely to be struck by lightning, so to speak, before you get one of these side effects. But it's very important to remember that. And if you do have a side effect, please let your physician know or let the place know where you received the vaccine so that side effect can be reported.
Thank you. Thank you, everyone. Any other questions? I'll have from our live audience. And I'll
The question that I have is, that I've been vaccinated, but it's dealing with other people. Like I work in a preschool and I volunteer on the board of my daughter's school. And I'm just, trying to deal with the extreme fear, right, that's out there in the community, like the hesitancy. And then, it sounds crazy, but people believe a lot of the stuff that's out there. Like I've seen it on Facebook from people that I know, not just random Facebook posts from people that you don't know, but people that I know. Comments about, turning into a zombie and growing a tail. And stuff that sounds very far-fetched, but people really believe that, and that stops them from actually getting the vaccine and for themselves as adults. And so then when we talk about the kids, there's even less of an opportunity. So I'm just, wondering how, and I appreciate you all for doing this. I want to see if, I know you guys did one in Spanish earlier that I listened to or something else, to be able to disseminate that information because, it's kind of one-on-one conversations with people that people that have experienced it, like trusted people. Because like you said, a lot of people don't show up for these things, but these are all the people that need the information. And I think people, especially in New Brunswick, people don't necessarily know about the statistics here locally, which are very different from what's going on statewide, like that you see on the news. And so that they're getting all of the information, to be able to make good decisions for themselves, their children, their community, the schools, and everything.
That's an excellent point. So I don't know the sound. So the comments is about a lot of hesitancy in the community and among among that and some of the far-fetched myths about people turning into zombies and growing tails. And I think all of us have been vaccinated, and I tell people I still don't have a tail. Still not a zombie last I checked, but they're still circulating. And the concern is that if the adults have a challenge with getting themselves vaccinated, how likely would they be to have their children vaccinated? And that brings me to a question actually that I wanted to pose to Dr. Whitley-Williams. And also Thalia, actually, both of you can weigh in on this is, so kids tend not to get, very sick, for the most part. I know at the beginning of the pandemic, we were all freaking out about what is this going to do to kids? I know I was, because I have little kids, and I was so worried about bringing it home to them and them getting really sick. And then later I realized that, I should be worried about me more than them. But, and as you said, but they still have the ability to spread it to other kids. Although, it seems from the studies that have been done, it's more likely that adults are spreading it to kids more than, kids spreading it to adults. So, if kids have gotten away light, with COVID, then why don't we just focus on vaccinating the adults? Why do we want to really vaccinate the kids if they don't get that sick? Why is it important for the kids? And I know they're studying the vaccine in younger ages. We don't have approval yet for below 12, but those studies are going on. But why should I even consider vaccinating my kids if it gets approved for a younger age?
Yeah, so thank you for that question. That's a great question. And one has to realize that the more people, including children, who are out there, our adolescents, our school-age children, the more people that are vaccinated, the better chance we have to control this pandemic. We're all in this together. It's not just adults. Our teenagers are out there, they're working in supermarkets, they have jobs after school. Our kids, they're together in, some do dance class and karate and, all different types of activities. Some of our children actually remain in school for the after school programs because they have to wait till their parents get home from their jobs. So you're going to have a lot of mixing and aggregation of children after school. I always, when I talk about that study in North Carolina, I said, you know, it was done in 9 weeks at the beginning of the school year. Remember, North Carolina is hot and they start back early in the summer. But what we really, and of course, the study's done in Scandinavia, obviously the weather was much colder. But we need to see what, you know, what is going to happen, you know, as we get into our winter months and the kids go back to school. So for that reason, especially our school age children, it is important to vaccinate them. It is crucial that they be vaccinated. So, you know, what we want to do is build vaccine confidence. I don't believe Black and brown people have a vaccine hesitancy. I think that was mislabeled. It's truly building the vaccine confidence, getting their questions answered, knowing that these vaccines were not rushed through the process. There were clinical trials. And there were Black and brown people in those clinical trials. There are never enough, but there were, it's like 10%, I think, Black and 14, 15% Latinx. So that's important. We need to participate in those clinical trials. The same is going on now, clinical trials in children, ages 6 months to 12 years of age. That trial is ongoing. Because again, we want to make sure not only is it effective, but we want to make sure that it's safe. So in answer to your question, it's important that we all get vaccinated. The more we're vaccinated, the safer we are, the less the virus can survive, and less likely is it to change and develop all these different variants. So that's the reason why.
And thank you, Dr. Swaminathan. You know, you added, as viruses change and evolve, you run the risk of a variant emerging that could cause serious infections in children as well. And I've been reading online that this Delta variant seems to be transmitted more easily among younger people, which might be one of the explanations why Africa is now getting hit harder than, you know, in the first 2 waves. Because I know, you know, at least in my, you know, country, Sierra Leone, we thought that they got away pretty light in the first couple of surges. There were very few deaths and not a whole lot of cases, but we have a very young, you know, over 50% of the population is under the age of 50. So a very young country, but now we're seeing a really high spike in cases. So, you know, that's something that, you know, we'll look at the data, but it speaks also to the importance of, you know, even the young people who tend to have mild symptoms to, you know, be mindful that a variant can come that would be more devastating in younger people potentially if we don't try to block the virus.
Dr. Swaminathan, can I just add to Dr. Whitley's point about, I think, the vaccine confidence, building vaccine confidence. One of the first things we did internally at the department was try to get everybody on the same page and accepting that everybody's going to have their own vaccine journey. And some of us who, you know, maybe frontline health workers, public health professionals, people who are like ingrained in this work, we've seen, you know, more illness and more death than we can handle. And so when the vaccine came out, it was like, no, we are not, we've seen the worst of this. We're doing everything in our power to keep this away from folks. So remembering that, you know, there was a bit of maybe a lack of exposure. So even some people were still, you know, calling COVID a hoax and saying it wasn't a real illness and all of these things. So I think respecting where people are in their journey, and like Dr. Whitley-Williams said, trying to boost their confidence, giving them factual, just continuing to give them factual information, continuing to combat the misinformation and the disinformation, and really just answering questions and being patient. I too, you know, I think you described, you know, people calling you and asking you questions, and I had to, like, you know, take a deep breath and maybe just roll my eyes to myself, like, you should know this, you know better. But, you know, I'm deep in it. So I have to take a step back and realize that it probably took a lot for somebody to ask that question. and answer it respectfully and as clearly as you can, and point them to resources so that they can, dig a little deeper, go down the research rabbit hole, and maybe answer some questions that they didn't even know that they had. And hopefully calm and soothe some fears that maybe they didn't know that they had either. So I think, we've been trying, and I personally have been trying to practice patience and just keep sharing the information over and over and over again, because you really never know. It might be the first or second time, but it might be the 22nd time that it really sticks with somebody and they finally make the decision to say, you know what, I'm going to go get vaccinated today. And I don't care how long it takes. Like, we just want more people to get vaccinated and be safer and healthier, so that we can get past this terrible time that we all face together as a global community, because it's been rough.
I hear you.
I also wanted to add a question that we've been listening a lot in the community now regarding people coming from the Caribbean and other countries that had gotten one course of, or maybe the 2 dosage of another type of vaccine from China, and what do we do now? I think that is something that we need to start addressing with our folks in our community. Right now, we heard from people in the Dominican Republic that even if they got the Chinese vaccine, they are now required to do a 3rd dosage of either Moderna or Pfizer. And, these communities are tight and people talk to each other, and then they all get all confused and they come running to us like, oh my God, they don't work. Now we need to do another one. And what to do with people that already have 1 dosage of one of those vaccines and now are in the US, and, when do we recommend that? The other thing I want to echo is what, Dr. Whitley-Williams mentioned about, what we find out there. And a lot of people just have questions and don't have a provider to ask those questions to, right? Or don't have the time. They're working in a factory, they're taking care of 1 million kids and the grandkids, and they're waiting for somebody to help them do that appointment. And nobody ever showed up. Nobody had the time. Nobody was visiting. I think that we are at that point that we need to go out and knock on doors. That's what we've been doing here in the city. And, we have been able to change the numbers, in a very short, time, using social media, Facebook Live, but also, visiting those restaurants and bars and whatever. We have a group of community health workers that are out there, talking to people, and we need to continue to reproduce them, because we need familiar faces, people that they can trust to ask those questions. And I really appreciate what you physicians are doing. We need more of this. We've been doing this for a while now, since COVID started. But if you have the time, join me out and we can go and walk some of those streets up and down Franklin and try to get those numbers up. We'll give you whatever resources we have here from the hospital, because we know we need to be out there making sure that people have, access to make the appointments or walk in, and that there's familiar faces there that they can trust to ask those very important questions.
Thank you, Miriam. Does anyone have a knowledge of what the current recommendations, if you started having vaccine? I know different institutions were doing different things. That I'm not up on whether there's official CDC guideline in terms of.
There were some, yeah. We can get that information out, because I think it's very important.
Because the thing is, I was going to say that, the WHO also reviews, the World Health Organization reviews all those vaccines that are approved in different countries to make sure that they meet, this standard. So if it's a WHO approved vaccine that the person got, they should still, they should be fine. But what tends to happen is institutions that are coming up with, their own different policies, because those specific vaccines are not approved in the US. So that becomes the challenge. And unfortunately, and I think this is one thing that I think we as a scientific or medical community of public health, in a way, have done a disservice to the general population. The pandemic, we're all learning through it. We're learning, and on the scientific end, we might be a few steps ahead of the general population because we're studying the data and we're looking at it, but we're not always as quick to pass it on to the general population. And I think sometimes we're not as great as explaining some of the things that we don't have good enough information yet, and so people make rules that the population doesn't understand why, what does that mean? Like what you said, if you require someone who's been vaccinated in another country to get another vaccine, obviously they're going to think that the one they got is not good enough. So and that's something that I think for myself also, I'm going to try to look into that. But as Dr. Swaminathan said, the CDC doesn't have any guidance on that. So the message is, there's nothing official that says that those vaccines don't work, and when they're approved in a country, is because that data has been reviewed in that country and that it works, which is based on the studies, which is why they are giving those vaccines. So it doesn't mean that their vaccine that they got in their country doesn't work. It's just America.
I can add just one thing, that initially, one of the reasons we weren't mixing vaccines is you didn't know what the safety profile would be if you were mixing different technology. There is preliminary information from few studies are ongoing, and then data emerging from a study in the UK where they gave people 1 dose of the AstraZeneca vaccine followed by Pfizer. So initially, a virus vector, which is AstraZeneca, is very similar to J&J or Sinopharm. Yeah. They use similar technology, or even the Russian Sputnik vaccine, followed by the Pfizer vaccine. And when they gave that combination, actually the vaccine responses were almost as good as people who got 2 doses of the Pfizer vaccine, without significantly. The only difference was the people who got 2 shots of the AstraZeneca had fewer side effects than those that got the AstraZeneca followed by the Pfizer. But sometimes that may just be a function of your body's immune response manifesting as fever, achiness, etc. So I almost tell my patients, well, it shows that the shot's doing what it's supposed to do. So at least we have that information. So it's not guidance, but if someone needed to use that information to make a personal health decision, it's certainly not unreasonable to do that.
So it doesn't mean the first ones didn't work, but you might have some added boosted benefits if they got the other technology vaccine.
Well, if you weren't able to complete it, I mean,
if you were not able to complete
right,
your
you got one
initial
shot,
period.
right. You shouldn't be left hanging.
Gotcha.
That was my understanding as well, because with the WHO, it's if you're needing a second dose, you should get the second dose of, you can have a mix of the different vaccine in order to get that second dose. I haven't heard where you got the 2 doses and then were told to be re-vaccinated. That I haven't heard. But I've heard about getting, when people come from one country and then come here, what do you do as a provider? You should giving them the second dose with whatever we have at this point in time. And you share with them the possible side effects. But I believe my colleagues saying that because it has been studied and looked at, but that is the recommendation that I was aware
of. Okay, if there are no more burning questions, it's always very enthusiastic and very great information that comes out of it. I feel like I learn a little bit more about the vaccines every time. Oh, actually, I do have one burning question for Dr. Swaminathan. I promised I was going to ask this question. So I was asked, were there any people of color or African-American people that were involved in the design of any of this COVID vaccines?
Yeah, actually, for Moderna, one of the key scientists was actually a Black woman. Many investigators, not just, even at our site, I would say my right hand, the physician or the co-investigators is Dr. Nayaku, who's originally her parents are from Africa. And at multiple sites, physicians have been, Black physicians have been front and center, both with the clinical trial development and the vaccine development. And we've also had a lot of physician leaders, Black physician leaders, participate in clinical trials as well.
Thank you. And we had Dr. Valerie Fitzhugh was on the panel the last time, and she was in the Moderna vaccine trial. So that was great. Thank you. And we'll make sure that goes out, because there's always a concern. It was like, well, were there really Black people who knew what was going on and looking over the shoulders? So yes, there were Black scientists who were part of the design and the clinical trials also. So looking out. Thank you, everyone, for your time. Thank you for being here. And if anyone, is interested, at this point in time, there's really not an issue with getting vaccines. If you wanted, pretty much any pharmacy you can get a vaccine from. If you're in the New Brunswick area, you can walk into Chandler Clinic and you can get your vaccine. There's no need for the complicated online registration and all of that. It's so much more easier now that we have more vaccines available. So take advantage, go get your vaccine. And if you have questions, reach out and ask a healthcare professional. We will be having another one of these on the 17th at Eternal Life Christian Church in Somerset on Franklin Boulevard. In Somerset on the 17th, we'll have a similar presentation. And as soon as we put together this recording in a format that's easy to share on social media, we will have that out to share. So if anyone who has questions, who has concerns about the vaccine, invite them to listen, invite them to come out, and we'll also post additional dates. We'll pass through the different networks for potential additional dates later in July. Thank you, Thalia. Thank you, Dr. Ayers. Thank you, Dr. Whitley-Williams. Thank you, Dr. Swaminanthan, for just making the time. And I know we went over. Thank you for being here. And Manny, Miriam, thank you for your support out in the community. Thank you to guests virtually and in person for making time to be here. Have a safe evening, everyone, and see you next time.
Thank you.
Thank you very much. Have a great evening.
Yeah, thank you.
Thank you.
All right.